Should you get a mommy makeover? Let's talk about it. I think we've all heard the phrase, right? Mommy makeover. And as the name implies, it is typically a way for many women to reclaim their pre-baby bodies and in some ways improve their pre-baby bodies. And it can really feel like a dream come true and a great fix for someone who has not only the physical toll of having children, but also the emotional toll that can come with that physical transformation. But let's face it, it's a huge decision and one that should not be gone into lightly. So let's really do a deep dive into what a mommy makeover is and whether or not it's a good idea for you. So let's break the why down first. Why get one in the first place, or why think about getting one in the first place? Well, as many of you mommies can attest, pregnancy and having children is really a beautiful part of life. But it does come with physical consequences, let's say, that are really hard to reverse. These can include change in the shape and the size of the breast tissue. It can include these new stubborn areas of fat that are hard to get rid of on our own. And it can include things like stretch marks, loose skin that doesn't bounce back. And the other thing that we don't see on the outside, but women definitely can attest to on the inside, is that loss of core strength from the diastasis recti. Remember? So I've talked about this before in other videos, but if you don't remember, we are all born with rectus abdominis muscles. And those are the things that give us our six-pack abs. When we are born, they basically touch just like this. As we do things like gain weight or have a person growing inside of us, they separate to accommodate that change in abdominal girth. But losing the baby weight, delivering the baby doesn't always mean that those things come back together. So while not just a physical transformation, that can actually be a functional issue as well, as we lose core strength and put more pressure on our backs. And not just functionally, these physical changes can cause an emotional toll as well. Imagine going through a pretty intense ride, a 10-month, 40-week ride, having a baby that is beautiful and beyond anyone's wildest imagination, but then feeling like the person who went through this ride is not necessarily who you are, feeling like a stranger in your own body at times. And this can really have an effect on confidence and self-esteem. The message that we get is that at the end of this journey that you go through to have a baby, you are to feel grateful, right? Because there are a lot of women who aren't able to have that same journey. To then be worried about some loose skin or stretch marks seems so incredibly superficial and small. But that's just not fair. It's not fair. You go through this major physical toll and you just want the body that you remember loving to be the one that you see at the end of this journey. It really is about reclaiming who you are as a person, not just being vain, right? It's about having that outside match the inside. And that's a lot of where my work lies as a plastic surgeon, having the outside match who we think we are on the inside, who we believe ourselves to be. When there is incongruence between who you believe yourself to be and who you physically present, it can be incredibly damaging to the soul. And so this isn't just superficial vanity. This at its core is about who we are. So let's start there. What is a mommy makeover? It's a nice phrase, but it encompasses so much more. And typically it's more than one procedure. Because again, this is not just something that happens to your belly. This happens to your entire body. And so we really do address the multiple areas that can and will be affected by pregnancy and breastfeeding. The two main areas are the breast and the belly, right? So for the breast, if we've seen major deflation after breastfeeding is done, then we can suggest an augmentation. We can suggest a lift plus an augmentation. Sometimes the breast will enlarge with pregnancy and breastfeeding and then not return to their once former size, and so be much heavier than they used to be. And in those cases, we recommend a breast reduction. And sometimes, again, there's just a lot of sag, a lot of ptosis that we want to deal with, and that can be done with the lift. For the belly, usually we are addressing the loose skin, and in many cases we're also addressing that separation of muscles, that diastasis recti. So we're physically sewing the muscles back together and then taking out all of the loose skin. So really, Mommy Makeover is a combination of procedures that are tailored specifically to the issues that and concerns that you have, that you would like to address. So when we're talking about getting rid of loose skin and addressing that diastasis recti, we're talking about a tummy tuck or an abdominoplasty. If we're just getting rid of some of the loose skin, that can be a paniculectomy. If we also have areas of stubborn fat that we also want to address, that would involve also liposuction. So make no mistake, it is a big surgery that we've made into one nice phrase with a little bit of alliteration, a Mommy Makeover. So it's not something that you can enter into lightly at all. And the other thing I want to address is that at no time is this about weight loss, right? You do not lose weight, significant weight with a Mommy Makeover, or you should not. By the time you are ready for surgery, you should be at the weight that you want to be. We'll take off a few pounds here and there with lipo, but lipo is never a source of weight loss. It is only for body contouring. So the after is amazing. Typically, women are truly, truly happy with their results. They love the skin that they're in, and life can't get no better. And that's what we hope for all our patients. Picture a flatter, tighter stomach, a little bit less in terms of stretch marks, perkier breasts. These are all the things we love, no matter who you are. We love to discuss, we love to look at sometimes too. Weirdo? Oh, maybe not, I don't know. And so the results are truly, truly amazing, and people do feel really good. But let's not get past the part where you have to recover from that. The recovery from this kind of procedure is super, super tough, especially because we're combining procedures at once. It can mean a long surgery. It's an area now that's an extensive area where there's been trauma to the body that the body must heal from. And so when you break it down, the recovery is probably the part where people kind of gloss over what that's going to look like, or can't imagine the lengths or the toughness, the mental toughness that you'll have to be able to get through this process. So imagine the first 1 or 2 weeks. There might be lots of pain, even with pain medication involved. There will probably be lots of bruising. There'll likely be lots of swelling as well. You'll be asked to wear compression garments 24/7, and you will likely, or may not, but most likely, will have some type of drain in place. The drain, especially where the drains go into the body, can be exquisitely tender. They can get very irritated. When the drain slightly tugs, from personal experience, as a person who's had drains before, it can be really tough. So you have to be prepared for that first 2 weeks to just be absolute shit, excuse my language. After the first 2 weeks, life does get better. But remember, for the first 6 weeks, you cannot lift anything heavy. I say more than 10 pounds, other surgeons may be more stringent or less stringent. And you cannot do any kind of exercise. But even walking will seem like a chore, but we will definitely ask you to walk, because walking, 1, decreases your risks of having major complications, and 2, helps a lot with getting swelling to go down. But you absolutely, absolutely cannot pick up your kid or cuddle with them like you'd want to. You have to have someone else who is there, who's an adult, or a couple adults, who will be the primary caregivers for you and any small children. Do not rush back to work. Even if you have a desk job where you do nothing but type at a computer all day, there is no need to rush back to work. You're going to feel groggy, you're going to be in pain, you're going to be bruised and swollen. And so even imagine sitting for 8 hours or 7 hours at a desk chair. That can be quite excruciating and quite painful. And so really do the prep work and take time off. Now, for individual procedures, I normally say, so for instance, a breast reduction, I would say at least take 2 weeks off from work. For an abdominoplasty, I would say probably 3 to 4 weeks. So if you're having more than one procedure, combine that time off and really take the time for yourself. You paid all the money, you went through all this work. Take the time to really recover and give yourself grace during this time. I've met a lot of women recently as we've done Revealed. Remember, Revealed is every third Friday of the month. But during Revealed, a lot of women said to themselves that they needed to give themselves grace during this recovery time that they hadn't previously thought of because they didn't realize how tough the recovery process would be. At 6 weeks is when I say most people will feel largely back to normal. But remember, that's you feeling normal. That's not that everything and all the healing is done, right? In fact, swelling from a tummy tuck can take 3 to 6 months, up to a year to resolve. Swelling and bruising from a breast operation can take just as long. So you really won't see the results for 6 months to a year even, really to be able to fully appreciate how great everything went. And also 6 months to a year is how long we give the scars to flatten and get rid of the redness. And so any ideas for a scar revision typically are not even addressed until that year mark. So patience, as they say, is a virtue, and during this period of recovering from any surgery, but especially these kinds of combination surgeries, it is almost a requirement to have, both from you and the surgeon. I know as a surgeon, I get really impatient as well. Why aren't you healing any faster? But truthfully, I never said that to patients, by the way, but truthfully, it does require a lot of patience from you and those around you to really fully appreciate how great the results will be. The risk, and this is meant to scare you, right? This video is meant to scare you because it's a huge decision and you always want to go on something that's huge with mental toughness, right? So the risk of anything that we do in a hospital setting or medical setting include things like bleeding, infection, scarring, reaction to the anesthesia, some nerve damage. The biggest risk that we have with tummy tuck specifically is that you definitely have a risk of developing a blood clot in the legs and even in the lungs. This is why it's very important that you follow your surgeon's restrictions and recommendations as it pertains to moving around. If you had a tummy tuck by me, I'm sure you've heard me say that the first night of surgery, the first night, you get home and I want you to walk. I don't want you to lay in bed all day. I want you to walk from the bedroom to the kitchen, from the bedroom to the bathroom. Do as much walking as possible so that we can get those legs moving and keep the blood from pooling in your legs where you can actually get a blood clot. Other risks that we can see, they're rare, a little bit more, well, all these risks are really rare. These are really safe procedures, guys. But other risks that we can see, if you have liposuction, you can have contour irregularities. You can also develop a fat embolism with liposuction. Fat embolism is not unique to the BBL. It is quite rare to develop a fat embolism with the liposuction, but it is possible. I've never seen it happen, but it's possible. You can also have, with breast surgery, the inability to breastfeed in the future, although I'm hoping that you're getting this done after you've had all of your kids, right? That'd be the cost-effective thing to do, at least. You can have actual nipple loss after any breast surgery. It's not common, but it is possible. You can end up with changes in sensation, especially if you had a tummy tuck. You will notice that your belly, the front of your belly is numb, and that's completely normal. Nipple sensation can also be altered to the point where it's numb for a few months, and that is completely normal. You can have asymmetry. Remember, things are not made perfect, and we as plastic surgeons will do our best to achieve symmetry, but we aren't perfect either. So now, final checklist. Am I a good candidate for a women makeover? Well, let's break it down. Some of these things you probably heard from me before, but let's really just put it all into one, okay? Right? So firstly, your weight should be stable. You should not be fluctuating weight. And when I mean changes in weight, I don't mean 5 pounds here or there. I mean major fluctuations in weight. Your health should be in great position. There should be no concerns about your lungs, your heart, or anything of the sort. If you have diabetes, that should be under well control. Your health is of extreme importance in this, because at the end of the day, ultimately your safety is the most important, and you want to minimize your risks around the time of surgery. Third, you should really be done having children. This should not be something that you think about after you've had 2 and then maybe you'll have a 3rd one later on. You really should be done having children. Again, it is the most cost-effective way. It's the safest way. It's just the best way. I haven't met a woman yet who plans to have children after doing this, but if there's even a thought of maybe I could one day, then I would just wait. The 4th thing is you really have to go in with a realistic mindset. I've said this before and I say this again. AI has us thinking that everything is possible, and everything is just not possible, okay? So yes, you can look to Instagram and TikTok for inspirations and goals, right? Body goals. But at the end of the day, it is you, it is your composition, it's your DNA that's going to determine what result you get. And so you really need to be realistic about the results that you're going to achieve, and also about the way that you're going to be able to recover from this major operation. And then lastly, this should be no surprise to anyone who's seen any of my videos, you need a board certified plastic surgeon to do this operation and to do it well. Full stop. There should not be a person who did a weekend course in Maui and is a cosmetic surgeon. No, a plastic surgeon who's gone through training in plastic surgery and is board certified or otherwise, or similarly credentialed in plastic surgery. And also, this kind of is unspoken too. The surgeon that you choose should be the one that you like and that you feel comforted by and feel secure in. You really shouldn't go to someone just because they have everything but that personal touch that makes you gel with them. You're going to be spending typically my patients spend about a year with me. They don't see me every week during this year process, but you will be seeing me for basically a year. And I'd like us to have a good year, okay? I would like you to have a good year. You're going through a tough operation, a tough recovery that may or may not require revisions too, right? And so you really want to be comfortable with your surgeon, in addition to feeling like they are a safe surgeon. Ultimately, it's a very personal and difficult decision. It requires a lot of thought. And I've never had a woman makeover, but I want to hear from you guys who have, or you guys who are thinking about it. If you've had one done, what's the one piece of advice that you would give to someone thinking about it? And if you haven't had one yet but are thinking about it, what's the biggest question that you have before you decide? Leave your comments and your questions below. Like and subscribe, and as always, love you lots, and bye for now.